Silalahi. I will explain about normal physiology.
I am Anisa Pratiwi. I will explain about the reason of tuberculosis disease.
My name is Maulidina Aulia Rahmi. I will explain about relationship between tuberculosis and nutrition.
My name is Megita Anastasya Samosir, and I will explain about the treatment of tuberculosis.
My name is Sinaga Yolanda. I will explain about pathophysiology of tuberculosis disease.
Happy watching!
Did you know that one of the world's deadliest infectious diseases can live silently inside your body for months, even years? Yes, we are talking about tuberculosis or TB. Tuberculosis or TB is a serious disease caused by a type of bacteria called Mycobacterium tuberculosis. It mainly attacks the lungs, but it can also affect other parts of the body, like the spine, brain, and kidneys. So, how do you know if someone has TB? Here are the common signs and symptoms. First, a cough to last more than 2 weeks. Second, coughing up blood. Third, chest pain. Fourth, unexplained weight loss. Fifth, fever, especially in the evening. Sixth, night sweats. Seventh, fatigue or weakness. So, TB spreads through the air when an infected person coughs, sneezes, or even talks. But here's the twist. Not everyone who's infected gets sick right away. That's called latent TB. You carry the bacteria, but don't feel sick and can spread it.
Next, we will discuss the normal physiological characteristic of patient before being infected with tuberculosis. The first is healthy lungs. Normal ventilation and gas exchange function without infection or tissue damage. Then, strong immune system. The body's defense or macrophage T cells are active and balanced, able to fight infection. Then, body organs function well. The heart, kidneys, liver, and metabolic system support the body's immune system. Next, good nutritional status. Body weight and nutritional intake are sufficient to maintain immunity. And finally, no symptoms of tuberculosis. No chronic cough, fever, neck sweat, or weight loss. This physiology changes when infected with Mycobacterium tuberculosis.
Now, let's talk about the causes of TB. TB is caused by the bacteria Mycobacterium tuberculosis. This bacteria can be spread to blood when an infected person coughs, sneezes, or even talks. How does the course of tuberculosis disease go? Let's discuss. When a person breathes in air containing Mycobacterium tuberculosis, the bacteria that causes tuberculosis, it travels deep into the lungs. This microscopic invaders settles in the alveoli, the tiny air sacs where oxygen exchange takes place. The immune system detects the threat. White blood cells, especially macrophages, rush to the site. They engulf the tuberculosis bacteria, but tuberculosis is clever. Instead of dying, the bacteria survive inside these very cells, turning them into safe houses. The body forms a barrier around infected cells, creating granulomas, tiny hard nodules. The bacteria are trapped but not killed. This is latent tuberculosis. The person doesn't feel sick and can spread the disease, but the bacteria wait. At the immune system weakness due to stress, illness, or age, the bacteria breaks free. They multiply rapidly, causing lung damage. Cough, fever, night sweats, and weight loss appear. Now it's active tuberculosis and it can spread to others. In some cases, tuberculosis spreads beyond the lungs to the spine, brain, or kidneys. This is called extrapulmonary tuberculosis. It can be severe and even life-threatening.
Nutritional status has a very close relationship with tuberculosis. First, malnutrition increases the risk of tuberculosis. People with malnutrition, especially lack of energy and protein, have low immunity. Malnutrition reduces the body's ability to control the growth of M. tuberculosis bacteria. Second, tuberculosis worsen nutritional status. Tuberculosis infection can cause reduced food intake. Therefore, tuberculosis infection increases energy needs due to the chronic inflammation process. Nutrition is a key factor in the course of tuberculosis disease. Malnutrition worsens the prognosis of tuberculosis. While meeting strong nutritional needs is very important to support medical treatment, improve immunity, and accelerate the healing process.
Treatment and healing of TB. Now, let's talk about how TB can be treated and cured. Even though this disease is serious, TB can be completely cured if the treatment is done correctly and treated and taken. TB treatment takes a long time, around 6 to 9 months. This is because the bacteria that cause TB are not easy to kill and can hide inside the body for a long time. At the beginning, the patient usually gets hormone antibiotics, isoniazid, ribavirin, pyrazinamide, and ethanol. These medicines are taken every day for the first 2 months, the most of the bacteria. After 2 months, the treatment must still continue, even if the symptoms are bad. Usually, the number of medicines will be reduced to 2 times, and they must be taken every day until the treatment is complete, at least for 6 months. The treatment must be done regularly and must not be stopped in the middle. If the patient stops taking the medicine too early, the bacteria can survive and become resistant to the medicine. This is called drug-resistant TB, and the treatment becomes much harder, longer, and more difficult. To help patients remember to take their medicine, there is a program called DOT, which stands for Directly Observed Treatment Short Course. In this program, a health worker watches the patient take this medicine every day, so the treatment goes as planned. TB treatment at government health centers like clinics or public hospitals is usually free of charge, so there is no reason to skip the treatment.
That's all from our video. We say thank you.